Hogg Foundation Mental Health Policy Fellowship has been an extraordinary gift to the state of Texas and to policy making at the state capitol. Without the Hogg Foundation Fellowship, many pieces of legislation simply wouldn't have passed. And we've been developing leaders in the area of mental health policy and in communities all across the state of Texas.
This was really, aside from an internship, it was really my first exposure to advocacy and to the legislative process. And I think the education and the hands-on learning experience was so comprehensive that I feel, even though it's only been 2 years, I feel like I've gotten a foot in the door in this field and that I've made connections that will be really long-lasting.
The Hogg Foundation helped empower me, gave me communication skills, how to work with coalitions. It connected me with a wonderful organization, Texans Stand Tall, that deals primarily in prevention. I'm a person in long-term recovery from a substance use disorder and mental health condition, and it helped me find my voice, that I can go out to the community and reach out and tell people this is who I am, this is what I believe in, and this is how I feel, what needs to change.
That became a very big confidence builder, that I could speak to what I knew in teaching young children, as well as the research that promotes best practices.
I'm supporting the bill, HB 2335. My name is Diane, and I'm the Mental Health Policy Fellow for Texans Care for Children.
That I could go to the Capitol, that I could talk to partners and get in front of conferences and speak to those things that I know about and I'm passionate about. That wouldn't have happened without this fellowship.
So what I'm most proud of from the last 2 years would have to be the passage of HB 1486, which was a peer policy bill that would allow certified peer specialists and peer recovery coaches to be reimbursed by Medicaid. And I think that we brought a whole new level of education around that bill that before they might not have had as much of.
Wow. Having any opportunity to learn and have direct experience and looked at as an equal is always great because it redefines how I feel about myself. So I really would say personally and professionally, knowing who I really am, knowing how empowered I am, and bettering myself was probably the biggest impact that it had on me.
The relationships were really the most brilliant and beautiful part of the whole experience, and now I'm tearing up already. I learned so much from each of the other fellows, from all the mentors that I encountered. They're just the most fantastic people. And I really have to give so much credit to Hogg, to Texans Care, and really to Katie for building this environment where we were really working toward collaboration rather than focusing on competition. It would have been so easy to create a structure where you have all of these budding professionals who have the same goal to make some sort of footprint on Texas policy and have us be combative and really competitive. But instead, they built this environment that I've never seen before, where we were encouraged to learn from each other, to be co-conspirators, in Shane's words, and to really lead with friendship.
The most rewarding part of participating in the program as a mentor is being able to help support somebody on their journey of discovery, so to speak. Watching our fellow grow and learn through experiences in the academy over the last 2 years has been truly inspiring. He's testified in front of several different committees on several different issues, organized advocacy events, met with representatives, and participates in several policy work groups. And that's really just a handful of his accomplishments.
I had the most incredible mentor who really showed me that even though I had no experience in policy work before, that with his guidance, I was open to a whole new world of being able to advocate on behalf of people with mental illness like myself.
I sought out help from my community. Family partners taught me so many things to help to keep my children healthy. I would like to see this access all across Texas.
And I think that's really brings power to my community in being able to advocate for the lived experience I have and really bring to the table the stories of what I've encountered. I think helped to push a lot of very successful mental health legislation.
I think the most important visit we did, there was 2 of them, and it was kind of a comparison, was the Harris County Juvenile Detention Center and then the Williamson County Juvenile Detention Center. Walking through those facilities and understanding what it looks like, smells like, sounds like on a day-to-day basis for the kids that are there, and understanding how that impacts them long-term was really powerful for all of us, and just made it more important for me to continue this work.
There was a gentleman who had started like a transitional home for people with mental health conditions, and he just organically started this house on his own, and not without a whole lot of state funding or any kind of funding. I mean, basically, you know, he just did what he could to keep this house open. I think that was a perfect example of how people can get well in the community, especially utilizing folks that have lived experience.
Hogg did a really good job of providing us with access to people at the federal level as well. So being able to go on these trips, whether they're local or whether it was the trip to DC, and being able to see things from a large systems perspective was really excellent. I really appreciate the way that the Hogg Foundation has fellows in different organizations with different focuses, with different ways of looking at mental health and moving the ball forward. So I think that we've done a good job with helping to change the conversation. And not only that, but I appreciate the leadership development that this program does so that the conversations that we have going forward, wherever we go in our other organizations, will also be more informed from a mental health standpoint.
It's offered a voice from the community that's being impacted, and if there's not a collaboration, there is not going to be an opportunity to move forward and to improve. That voice has to be there, I think, by default to make any type of progress.
Having a fellow expanded our capacity as an advocacy organization by leveraging the peer perspective and being able to have a peer who can offer the perspective of lived experience really enhanced our credibility as a mental health advocacy organization. And I think it made us a more respected organization.
I feel more confident walking into rooms that are intimidating and feeling that like I'm someone that belongs in that table and that I have a voice that matters. It takes practice, like with anything else, using your voice, especially in a room where people have so many credentials behind their names and your experience comes from like living and doing things. It's shaky ground at first, trying to raise your voice in that room, but being able to do so over and over again and seeing the value and impact of that has given me confidence that like we as people with lived experience have meaningful things that are missing from these conversations to add.
When you see former fellows, such as myself and various others, continuing to work in this field and making a positive difference and having an impact on these decisions, then you know that the program is working.